Good afternoon, everybody. Welcome to NHSA's Advocacy Lunch and Learn series. This afternoon's lunch is titled Working with and Supporting State Associations. I hope you had a few minutes in your day, enough time that you actually could get a lunch and have a chance to eat while you're listening. Um, so really glad you're able to join us. Um, my name is Blair Hyatt. I'm NHSA's Senior Director of State Affairs. And I'm here with you today along with Katie Dufford Melendez, our Manager of State Affairs. And what we do here at State Affairs is work with state associations in many different ways, but primarily on advocacy. So we're excited to do this webinar with you since it's so focused on something that's really primary for our jobs. Um, and this webinar, as you start looking at the slides, it's really a series of questions. We have some information to share, but largely we're wanting to engage your minds and your thinking about your relationship with state associations and state advocacy and how you do advocacy. So we're hoping to spur things in your mind. And we're hoping that, maybe you just came to this lunch and learn because the topic was so exciting. But honestly, what we really hope is that you're here because you've been part of the series, and hopefully this will help you think a bunch about advocacy or how you can improve your advocacy thing and implement the things you've been learning about through working with your state associations. Um, and if you're someone that likes to add things to the chat, maybe you could post something about what you're hoping for, or anytime you want questions that you have into the chat. So welcome. We're really glad to have you here with us. Katie, can we do the next slide? All right, so here's one of our many questions. Um, and the question is, state associations, why do they matter? And I'm not framing this question as do they matter? I think it's important that you have a chance to think a little bit about the why. Don't just assume that a state associations are there, but think about what is the important value that state associations can bring to you, but also to your advocacy efforts. Um, and we wanted to say a little bit about state associations. The capacity of state associations, or how they function, varies really, really widely, just like the United States. The states vary really widely. And thinking about that, about half of the state associations are functioning with volunteer leadership. That means probably some of you are state association presidents, vice presidents, treasurers, but most people are doing that job on top of a full-time, very busy Head Start job on top of that. So those people really deserve a lot of respect, but also remember that they are stretched thin, because if you've ever been a member of a volunteer association board, it's not an easy thing to run, and especially with things that are as busy as they are. Then there are about 10 state associations that have part-time executive directors or managers. And then there are 20 associations that have full-time executive directors, and some of them have 2 or 3 staff full-time with them. So they're really a big variety. Um, and we have associations with budgets less than $25,000 per year, 10 of them. So they also are operating on small budgets. Um, some of the associations have no social media presence or website, 13 of them. So some of your associations have not much capacity and others enormous capacity. But when you're working or partnering with their state associations, keep in mind who they are, what they look like, and how that works. Um, and the last thing, I think I've made my point, but I'll give a concrete example. I believe that the state of Delaware has 4 Head Start programs, and the California has 194 programs. So just give you, that's the variety of one end, small 4 programs, another state, 194, like just huge variations between the different states. Um, Now let's go to the question, why do they matter? Because of the individual nature of those states, they they're the best way we know to organize and think about advocacy, because advocacy in Delaware is different than California, different than Mississippi, different than Colorado. That's simple. Next slide, Katie. So our next question is, do you know about your state association? Do you get advocacy emails from them? Have you been to their website? Do you attend your state association events? Are you a member of their board? And I think maybe you could rephrase this question as, if you're connected, how are you connected? Or what do you even know? Because some of you might go, I don't really know much at all. And others of you, like I said, you may be a member of the board. You may go to all the events. You may have built their website for all we know. But think a little bit. So what's your experiences? And if we had lots of time for discussion, I'd ask you about that. But I just want to engage your brain about, what do you know? Then let's go to the next slide, Katie. So this slide is a little bit of a trick, but it is actually a link, and we'll share these slides. And if you click on that link, what you'll get is a spreadsheet. Thank you, Katie. That was great. That lists the presidents and executive directors of all of the associations. So if you're not connected or want to connect or communicate, you have email connection to each of your state associations. And we wanted to empower you to reach out if you are sitting there going, wow, I want to do something, I just don't know. How do I reach out to those people? Um, that's probably your best way to be in contact, easier than looking at the website if you don't know what you're doing. Next slide. Um, so we wanted to talk about the Go team. So starting last year, primarily last fall, we started building the national Go team. We will be sharing in the PowerPoint. There is an overview of the Go team. So if you've never heard about the Go team, you're going, what is Mr. Hyatt talking about? You can look and get more details. Very good one pager there. The short version of the Go team is that we are the team consists of one program at least for each representative and senator in Congress in Washington, D.C., who has agreed to be the responsive Go team that is connected to them, informing them, and building a relationship with them. Now, some places we have 2 or 3 programs working on it, but where our goal was to have at least one. If you wanted to be part of your Go team, you should reach out again to your state leadership if you're not already part of it. And there are some places where there are still we're still trying to add people. Then there's a lot of places that the team's completely built. But if you would be excited to be part of your Go team, we would love to have you be connected into them and that work. And the last message around that is we right now, while nothing is calm in our lives at all, um, in terms of advocacy right now, we are in a fairly, quote, calm period. And um, we are primarily waiting for the president to put out his budget proposal, which will be the formal beginning of the budget season for FY26. We are quite sure that regardless of what the president puts into that budget, um, we are going to need to be reacting probably strongly and forcefully in a way that we have never done before. And we've been getting better and better. The last significant email campaign we did, thanks to the Go team and people like you working very hard, we were able to send 108,000 emails to senators and representatives. And we are going to need to have the field speak up like that and stronger around the budget issues. Um, so I think that is good. I think next slide, Katie, we're ready to go to the next slide. So we've talked a bit about why both what state associations are like. We've talked about why they matter. We got you to ask questions about how do you have experience? Do you know your association? And we gave you information if you're not connected at all, who you would reach to. And then we talked about particularly the importance of the Go team in terms of our primary advocacy network. And I think that it is time for questions. And Courtney, do we have questions from the chat, or if somebody else wants to jump in, question time? It's great.
No questions so far, but want to shout out Kathy Yoder-Bass. She's a member of the Go team and she's here today.
Awesome. That's really
Yeah,
good.
saw that, Kathy. And then also Blair, there's just stories of Gwendolyn is in Ocean County, New Jersey, and connected with Bonnie, their New Jersey Head Start Association, who's phenomenal. I'm trying to scroll up because I saw somebody else said that they regularly attend their association's meetings and trainings. And people are coming in from all over the US here. Kathleen Dow says she attends the meetings and gets all the updates. And they also have annual conferences. So these associations are really active in so many of our states.
Yeah. That is what I wanted people to hear. And I want the people that don't have those experiences to go, wow, maybe there's something I'm missing. But I'm also warning you that you could reach into your state association and feel like you're almost an instant leader. But the Go team the Go team is the clearest place for you to join into a network that is a combination of us here at NHSA working with the state associations to improve our advocacy network. So I'm glad that I'm hoping people can tie those things together.
We do. I'm sorry to Blair to interrupt. So first of all, Stacy Copeland, she attends, Wanda's in the Florida Association. And I missed somebody else. Washington was here as well. But somebody said that they're part of Region 5 and anxious to see kind of where that will land.
What will land? The good question.
I'm assuming, I don't have them in, I can't find it again, but I think the question was in relation to with the closings of
Yeah.
the regional offices, but separate from our associations, I guess.
Yeah, no, that absolutely true. We are all deeply concerned and um we have got a form NHSA has been putting out. I think we have over 200 responses from across the country about concerns and impact of the regional closings. um, we are interested in that form because honestly, really people weren't the impact. We're still trying to figure out what the impact is. Mainly what we got was questions, how is this going to work, and concerns, but not yet impacts, meaning I wasn't able to get something approved. I haven't been able to get funding that I needed. I didn't know what to do when a health and safety concern came up. And on Friday, OHS put out a directive, and the short version of that was all of your financial concerns should go through the HSES system, and everything else they gave one general address for people to send. We'll see how that works. But like you said, we're really concerned about how that will play out. Um, and we know that people are deeply concerned and want to find a way to either to bring back the regional associate, the regional offices. It's good. Other comments or questions? It's good.
Again, just more conversations about the regional offices and if there are any talking points to advocate for them.
Um, I I do think we have regional office talking points, and I can't talk and drop them into the chat at the same time. We will get them to you, I promise. That is good question. Yes. It's good. All right. Um,
There's also a
and-
link, Courtney put in a link to the form that you were just talking about so that people
awesome.
can put in their concerns.
That's really good. Yeah. Um, so I think we should go to the next slide unless there are more questions or comments.
No, but also Courtney, also, thank goodness she's on the ball, dropped in our statement about our primary concerns and how these reductions can impact children and families.
Awesome. Really good. So, like I said, this is this 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 webinar is not so much about giving you tons of information. It's about trying to help your brain engage and think and make sure that you are engaged and benefiting from your state association because it's such a key part of being an effective advocate. Um, and so I want you to sit here and not just listen to all of this, and hopefully you really are munching on a sandwich or having a good salad and drinking a Diet Coke or something, but that you actually do take a minute, either mentally or literally, to write down. So what is your plan? What is your next steps with your advocacy and association? And then I have some suggested prompts, but these ones might not be the right ones for you, but could you go to their website and sign up for emails? Reach out to your association leadership. Take a more active role in your state association or in your Go team. But sort of take a moment to think, what is the one simple next step here for you in doing that? Maybe it's learn about what activities your association has coming up. Um, Maybe you're the president and you're overwhelmed and your goal is to find out how to find some more support so you can keep going as your state associate president. But think for you what your next steps are going to be. Um, And so that there's something you're going to do different, and or you're clear about what you're going to be in your next step here in this leadership plan. So,
And
and yeah, go ahead,
I'm
Katie.
sorry, Blair. How can folks get involved in the Go Team? What's the best way to reach out and be a Go Team member?
So I will make this really simple for you. If you know your state association president or executive director, you could email them. But if you really want to and you don't know them, shoot me an email, say, hi, I'm blank. I am from this state. And if you know who your representative, my representative is this. How do I get involved in your Go team? And I will connect you either to the people that are already part of that Go team or check in and with you and connect you in through your state. But if you send it to me directly, we'd be happy to do that, make sure that happens. I think that's great.
All right, I just re-put in the link to your state associations, and I am adding Blair's email. It's at the bottom of this presentation. We'll make sure you have it as well, but I'm putting it, if I can word things well, in the chat as well.
Mhm. Um,
There's more questions about just the regional offices, and people are sharing their experiences and how they're getting information.
awesome. Any questions that should be brought forward here?
Um, Sheila says that they'll continue to meet with local stakeholders to share nonpartisan advocacy campaigns. Again, more about what happens when the regions close and combine with other regions.
Yep.
Nicole, I'll reach out to you about the your visits coming up. So thank you for sending that email.
Mm-hmm.
That's all I'm seeing so far. Hold on to your messages.
Okay.
Diane says, it seems like we're good at asking our parents to advocate for us, but staff, we're being asked to sort of stay under the radar as not to bring attention in fear of losing funding altogether and complying with stupid things like DEI ban. Their DEI is our whole thing.
Yeah. That is a good point. And once I do this other thing, I will go back to it. So I am now posting our FAQs around the regional office closures because people asked about them. And also here are our talking points for parents and staff is the next thing that I'm posting in the chat. And Courtney, thank you for posting everything you did have, and I'm happy to grab the things you needed from me. So the person that was talking about funding cuts, the fears around funding cuts, around block granting, about, just people are afraid for the continuation and of Head Start. We feel threatened, and and there you're not wrong to feel threatened. That's why we are emphasizing you being engaged in your Go team, but also you will get information from NHSA when the budget comes out about what to do. All right, I just got told that I gave the same link twice, so let me try this better this time. Let's see if
While you're looking, there's a question about when do we anticipate hearing about the fiscal year 26 budget? And so Blair's got a couple things going on. So I'm going to do a shout out if it's okay. When Blair mentioned the block granting, one of our other efforts is to really get examples of how Head Start programs serve local communities and how we provide examples of local flexibility, whether that is serving a faith-based community, partnerships with parks and outdoor organizations, healthy eating, mobile units, recovery programs. However, our Head Start programs are serving their local communities in unique ways and showing the flexibility of that. I would love to hear about that. My email will be at the end of this presentation as well. Sorry, Blair, shameless plug for another project that we're doing to always fight
I love
for
that plug.
programs.
All right, so I am having a challenge here. Give me a minute. Talking points. All right, I finally got a different link that I need. I think I got what you needed. This is paste. All right, let me know if that one is different. I think it is. Thank you. All right, so like I said, I was speaking to, things are serious. It's why we need you connected to your Go team. It's why you need to be getting information from your state about what they're doing and recommending you do. It's and the other part is that our advocacy link, you can always go to our advocacy link over and over again. And that one right now is focused on COLA, meaning putting enough money into the FY26 budget so that there's enough money for a COLA for staff, for increasing staff funding. But that is just the beginning for when the president releases his budget, which is sort of the beginning of everything that'll go on with the Senate and the House for Head Start. We are primarily focused on that because that is the bread and butter of what's going to keep Head Start programs running. We do understand that DEI, immigration, potential cuts to Medicaid, potential cuts to SNAP, the regional offices closings, all of which are serious things that will have a real serious impact on the families and children that we serve. But the key factor is keeping us going, and that's why NHSA's strategy is focused in the direction that it is. And that's not something that I think we came to easily as our strategy, or that is necessarily a comfortable strategy for us or our members. But that is the strategy and thinking. And we do understand that there is so much, much, much more going on. So that's good. And I think that's it. I got to my 30 minutes. Katie, are there any other urgent questions that came up in that last little bit? No?
I was muted. Nope, I do not. I know that Nicole's asking about the president release, his budget, and Courtney put in a link to advocate for the fiscal year 26.
Yeah. We in a world where nothing is predictable, we would guess the president's budget will come out somewhere between late April and May 19th, the first day of our conference in Columbus, Ohio. So sometime in that time frame is what we're aiming for. It's good. Thank you, everybody. Appreciate everybody's time and attention. These are challenging times. Be connected to your state association. Be connected to the Go team. And we look forward to continue to work with you. Thank you.